Healthcare workers at Swedish Medical Center, which is really just the name that Providence St. Joe's ended up keeping after they acquired it, have had enough and went on strike. I'm sure you've seen it all over the news with endorsements from Elizabeth Warren, Bernie Sanders, Pete Buttigieg, Amy Klobuchar, Joe Biden. They've all stated that they stand with the healthcare workers of this union that are clearly at their wits' end. But what's not clear when I talk to the public, no matter how much media coverage or press releases come out, they seem to think that this is solely nurses fighting for pay. Pay to correlate with the ever-rising cost of living in Seattle, but it is so much more than that. This is for patient safety. And when I say that, I mean your safety and your family's safety. If you haven't been already, at some point, you're gonna be one of our patients. And right now, they're outside saying it's not safe for you to go there. These are the dieticians that help your dad manage his diabetes, the CNAs that break their backs, assisting all day, every day, the pharmacy staff that make sure that all the medications going to that little newborn in the NICU are exactly what they should be, the respiratory therapist that manages the ventilator that little boy ends up being on, the radiology techs, which make sure the MRIs of your loved one's brain is showing us exactly what it needs to show us. Lab technicians that are in charge of all of your blood tests and the accuracy of the results. The housekeepers that are responsible for maintaining a clean hospital environment. The ER tech that keeps doing those chest compressions to keep mom's heart beating while her life is being saved. And I could keep going on with the other professions that do what they do day in and day out, but they've all been outside, standing out there, saying that it's not safe inside of there. What they want is for Providence St. Joe's or Swedish to agree on a contract that not only says, hey, the cost of living in Seattle has gone up astronomically. Can you please help us afford to live where we grew up, feed our families, and give care to the communities we're giving care to? But for flat out patient safety. They want enough workers hired to be staffed so they don't have to worry for you. Because they wouldn't be outside right now if they weren't worried for you, our community. This is a vital negotiation, and there is no room for CEOs that are making millions to be stonewalling on issues of this gravity. 8 months now since negotiations started, and after being denied over and over again, the healthcare workers said, I'm sick of it, and went on strike. While millions were spent to fly in thousands of highly trained relief workers from all over the country to take care of our patients. While not only healthcare workers from this hospital system stood outside picketing, but healthcare workers of other hospitals, healthcare workers of hospitals that aren't even unionized, firefighters, policemen, teachers, all sorts of labor organizations, and our professionally unaffiliated, but personally very, very affected community members stood out there with them. In our lovely Seattle weather. And we can't thank you enough for that. It's not us versus them, okay? That's battle, that's war. This is healthcare. So again, they're gonna sit down and negotiate. And for the sake of the safety of every single person in our community, I hope this tremendous hospital system that helped build the proud foundation that I stand on today, that is fortunate enough to have some of the most skilled healthcare professionals I have ever worked with, takes the opportunity to do the right thing.